Have you ever wondered if the routine medical tests you rely on each year to protect your health could secretly be causing more harm than good? Every year, millions of seniors line up faithfully for checkups, trusting that these tests are their best defense against disease. But what if I told you, as a physician and researcher with decades of experience, that recent studies have exposed a disturbing truth? Nearly 40% of medical screenings for seniors over 70 are leading directly to unnecessary treatments, dangerous complications, or even lifelong side effects. And shockingly, more than 99% of seniors never hear this from their doctors. One routine test alone has now been linked to around 5% of all new cancer cases in the U.S. That's as much cancer as daily alcohol consumption causes, yet doctors rarely mention it. Don't worry, I'm Dr. Charles, and today, in less than 10 minutes, I'll share exactly which 5 medical screenings after age 70 you need to reconsider. More importantly, I'll reveal safer, proven alternatives recommended by organizations like the World Health Organization and the American College of Physicians. These are the same strategies I've successfully implemented with hundreds of my patients, helping them live active, vibrant lives without unnecessary risks. But first, let me ask you, have you ever regretted getting a medical test or procedure because it turned out to be unnecessary or harmful? Share your experience in the comments. I personally read every single one and reply with personalized advice. Now let's dive into the first common screening test that might be quietly harming your health and what you should do instead. Let's start with the first screening test you might want to think twice about after age 70, the bone density scan, or what doctors call the DEXA scan. Now, on the surface, this test sounds completely harmless. It's quick, it's painless, and you walk out thinking you're getting valuable information about your bones. But here's the uncomfortable truth most clinics won't tell you. After 70, bone density scans often cause more anxiety and unnecessary treatments than real benefit. Let me explain. As we age, it's natural for our bones to lose some density, just like it's natural for our hair to turn gray or our skin to wrinkle. But the medical system treats these normal changes like problems to fix. That's why many older adults who take a DEXA scan end up being labeled with something called osteopenia, a mild reduction in bone density that is not osteoporosis. Unfortunately, this label leads to medications, usually a class called bisphosphonates, like alendronate or Fosamax. These drugs are meant to prevent fractures, but they come with risks of their own. Painful esophageal irritation, severe acid reflux, and even rare cases of jawbone necrosis, where part of your jaw starts to literally die. According to a 2022 study in Osteoporosis International, treating mild bone loss with medication in seniors over 70 reduces fracture risk by only about 0.3% over 5 years. That's almost negligible, yet the side effects can be life-altering. Let me tell you about Rose, a real patient I worked with. She's a 76-year-old retired piano teacher. Never had a fall, never broke a bone, and walked every day. After her checkup, her doctor sent her for a DEXA scan. It showed mild osteopenia, not dangerous, but enough for her doctor to start her on bisphosphonates. Within 3 months, she developed severe reflux and jaw pain. She stopped playing piano. She stopped walking. Her quality of life declined rapidly. When she came to see me, we immediately took her off the medication. Instead, we focused on functional strength training, light resistance exercises, and a calcium and vitamin D rich diet, things like sardines, leafy greens, and fortified plant milks. A year later, Rose was back on stage, performing piano recitals, stronger than before, with 0 fractures. The World Health Organization has long emphasized the role of lifestyle interventions over medication for seniors who aren't actively falling or fracturing bones. In fact, exercise and diet have been shown to reduce fall-related fractures by over 20%, which is dramatically higher than any pill. So here's the lesson. If you're over 70, active and not prone to falls, think carefully before agreeing to a bone scan. Don't let a number on a piece of paper dictate your life. Sometimes, strength training is the better prescription. Now let's move on to the second medical test you should think twice about after 70, and this one might surprise you. It's the brain MRI for memory loss. Look, I get it. We all worry when we start forgetting things. You misplace your keys, you forget someone's name, maybe you walk into a room and can't remember why. The first thing that comes to mind is, am I getting dementia? Could this be Alzheimer's? So naturally, doctors often respond by ordering a brain MRI. It feels like the logical next step. But here's the problem. Most brain MRIs in people over 70 don't tell you anything helpful, and they might do real harm. Why? Because almost everyone over 70 has normal age-related changes in the brain. Things like mild shrinkage or tiny white spots on the scan called white matter hyperintensities. These are not signs of disease. They're like wrinkles on your brain. But once a radiologist points them out, fear kicks in. The patient panics, the family panics, and the healthcare system starts a cascade of tests, many of which are completely unnecessary. In fact, a 2021 study in Neurology Today reviewed over 3,000 MRIs in seniors who complained of mild forgetfulness. The results: 86% showed some kind of brain abnormality, but only 3% were linked to anything treatable. That means for 97% of people, the scan caused emotional stress without providing solutions. Even worse, around 12% of those patients were sent for invasive procedures, like spinal taps or brain biopsies, all because of something seen on a scan that was probably just normal aging. Let me tell you about George, a 74-year-old retired engineer who came to see me. He was worried because he misplaced his keys more often and sometimes forgot names at church. His doctor ordered an MRI which showed white matter changes. George became convinced he had early dementia. He stopped driving. He stopped going to his weekly game nights. His anxiety skyrocketed. But when we did a simple cognitive screening test, a paper and pencil exam, the results were completely normal. No dementia, no Alzheimer's, just normal aging. We focused instead on the basics: improving sleep, staying hydrated, daily walks, and brain games like crossword puzzles and chess. Within 3 months, George's confidence and memory improved dramatically. He was back to his old routines, happy and independent. The truth is, unless you're experiencing seizures, sudden personality changes, or rapid functional decline, an MRI for mild memory loss often causes more problems than it solves. A much safer and smarter first step is something called the MOCA test, the Montreal Cognitive Assessment. It's quick, painless, and costs almost nothing. It screens for real memory issues without the risk of overdiagnosis. As Dr. Jason Karlawish from the Penn Memory Center often says, we need to stop equating every lost name or misplaced key with disease. Aging is not a diagnosis. Next on the list, the cardiac stress test. This is number 3, and for good reason. It's one of the most overused tests in seniors, and it often does more harm than good. Now, don't get me wrong, the stress test has its place. It's designed to check how well your heart handles exercise. Typically, you walk on a treadmill while your heart is monitored for abnormal rhythms or signs of blocked arteries. But here's the issue. After 70, especially if you don't have classic heart symptoms, this test becomes a dangerous gamble. Why? Because the false positive rate is sky high. Studies show that in adults over 70, the stress test can falsely suggest a heart problem up to 40% of the time. That's almost a coin flip. And what happens next? More invasive tests, like cardiac catheterization, where a tube is threaded into your heart's arteries. Sometimes doctors find mild plaque that may not even be dangerous, but they still place a stent, thinking it's preventive. Here's the problem. A landmark 2017 study in JAMA cardiology found that over half of all stents placed after stress tests were unnecessary. The patients didn't have significant blockages, and placing a stent didn't help them live longer or feel better. What did happen? Increased risks of bleeding, kidney injury from contrast dye, and prolonged hospital stays. Let me give you a real example. Raymond, a 75-year-old retired postman, came to me after his checkup. He mentioned he felt more tired walking up hills. His doctor ordered a stress test just to be safe. The results came back borderline. That led to a catheterization, where they found a mild narrowing in one artery and placed a stent. But that night, Raymond had a reaction to the dye used during the procedure. His kidneys started to fail and he spent 6 days in the hospital. The worst part, his fatigue didn't change because the issue wasn't his heart at all. He was just a healthy older adult who needed better hydration and more balanced meals. So here's the takeaway. If you're over 70 and not experiencing classic cardiac symptoms like chest pain on exertion, severe shortness of breath, or fainting, a stress test may not be the right move. A safer alternative. Start with a resting EKG, which is simple, fast, and checks your heart's rhythm without stress or risk. Or consider a coronary calcium scan, which uses low-dose radiation to look for dangerous plaque buildup. It's far less invasive and gives you real insight into your heart health. As the American College of Cardiology reminds us, in seniors without active symptoms, less testing often leads to better outcomes. Now let's talk about the fourth test you should reconsider after 70, the colonoscopy. I know what you're thinking. Colonoscopy is one of the gold standards for cancer prevention, right? We've all been told to do it regularly. And yes, for people in their 50s and 60s, colonoscopy saves lives. But after age 70, especially after 75, the risk-to-benefit ratio starts to flip. Here's why. The procedure itself isn't just about the camera. It involves aggressive bowel preparation, drinking liters of laxatives that can lead to dehydration, dizziness, and kidney problems, especially in older adults. Then there's sedation, which increases the risk of post-procedure confusion or even long-term cognitive decline in seniors. And let's not forget the procedure risks. Bleeding, tearing of the bowel, and dangerous changes in heart rhythm during sedation. According to a massive 2019 study published in JAMA Internal Medicine, for every 1,000 colonoscopies performed in patients over 75, only 2 lives were saved, while over 20 people suffered serious complications. That's a 10-to-1 ratio of harm to benefit. Now consider Dana, a 73-year-old grandmother who ran a small bakery with her daughter. She felt great. No symptoms, no blood in her stool, no family history of colon cancer. But her new doctor insisted she get a routine colonoscopy, even though she'd already had 2 clean ones before. During the procedure, a small polyp was removed. That night, Dana experienced severe abdominal pain and collapsed. She was rushed to the hospital where they found a bowel perforation, a tear in the intestine. She spent 9 days in recovery, lost 10 pounds, and months later, still struggles with fatigue and pain. The truth is, most polyps in seniors are slow-growing and harmless. Removing them may do more harm than leaving them alone. That's why the U.S. Preventive Services Task Force now recommends stopping routine colonoscopies after 75, unless there are specific red flag symptoms like rectal bleeding, sudden weight loss, or a major change in bowel habits. For healthy seniors who still want screening, there are safer, non-invasive alternatives. One is the FIT test, a fecal immunochemical test you can do at home. No sedation, no prep, and it still detects most concerning cases. Plus, it's backed by the World Health Organization as an effective method for colon cancer screening in older populations. The key takeaway: if you're over 70 and not at high risk, you probably don't need another colonoscopy, especially if you've already had clean tests in the past. It's okay to say no. Finally, let's talk about the fifth and most dangerous test seniors are being sold today, the full-body CT scan. These scans are heavily marketed, especially in private clinics. You'll see ads promising to catch cancer early or give you peace of mind. But here's the cold truth. For seniors, full-body CT scans are more likely to start a medical nightmare than prevent one. Why? Because they expose you to massive amounts of ionizing radiation. Each scan delivers about 10 to 20 millisieverts of radiation. That's like getting 500 chest X-rays in one go. And here's where it gets scary. A 2023 modeling study published in JAMA Internal Medicine found that the growing use of CT scans may now be responsible for up to 5% of all new cancer cases in the United States. That's right, 1 in 20 cancers could be caused by the very scans meant to detect cancer early. It's on par with daily alcohol use as a cancer-causing factor. But the damage doesn't stop at radiation. These scans often find incidental findings, tiny nodules, harmless cysts, calcifications, that are completely normal for aging. The problem is, once they're spotted, doctors can't ignore them. So you get sent for more scans, then biopsies, sometimes even surgeries. And each step carries risks. Let me tell you about Marcus. He's an active 80-year-old who used to teach martial arts to other seniors. He felt great, no pain, no health concerns. But at a private clinic, he paid for a senior elite checkup, which included a full-body CT scan. The scan showed a tiny 3-millimeter lung nodule, the kind of thing 40% of older adults have without issue. But because it was there, Marcus was sent for a PET scan, then a needle biopsy. During the biopsy, part of his lung collapsed, a complication called a pneumothorax, and he spent 2 months recovering in the hospital. And guess what? The nodule was benign. It never needed to be touched. This is why the American College of Radiology is crystal clear. Full-body CT scans should never be used for general screening in healthy adults, especially seniors. There is no proven benefit and significant potential for harm. So what's the better path? Listen to your body. If you feel well, focus on lifestyle, stay active, eat well, and do routine checkups with your primary doctor. Only get imaging tests when there's a specific symptom or concern, not just for the sake of scanning. As Dr. Rita Redberg, cardiologist and editor of JAMA Internal Medicine, puts it, when it comes to medical tests, sometimes less is more, and no test can replace good health habits. So let's take a step back and reflect on what we've learned today. By the time you reach 70, your health priorities shift. It's no longer just about catching every possible problem. It's about avoiding unnecessary risks. The truth is, modern medicine can save lives, but it can also overdo it. Some screenings cause more harm than good, especially when they lead to dangerous side effects, unnecessary surgeries, or the emotional toll of false alarms. Let's recap the 5 health checkups you should think twice about after 70. Bone density scans often lead to fear and risky medications when strength training and vitamin D work better. Brain MRIs for mild memory loss usually show normal aging changes that trigger panic and invasive tests, when simple cognitive screening is safer. Cardiac stress tests without symptoms can lead to unnecessary stents and heart procedures that don't improve life or longevity. Colonoscopies past 75 bring high risks with little benefit, especially if you've already had clean results. Consider FIT tests instead. Full-body CT scans expose you to dangerous radiation and may actually cause cancer, not prevent it. The bottom line, ask better questions before agreeing to a test. Always ask your doctor, what happens if this test finds something? What's the next step? Is there an alternative? If the answers are vague or the risks outweigh the benefits, it might be time to say no. As the World Health Organization reminds us, real prevention starts with lifestyle, staying active, eating nutrient-rich foods, maintaining strong social connections, and prioritizing good sleep. And remember, health is not about chasing numbers on a screen. It's about living fully with energy, purpose, and joy.